All right, it's Dr. Buford. We're just getting some. So as we look at the biceps anchor, you can see there's a lot of torn tissue. And the biceps here itself looks like it may be torn also. We're going to put in a shaver because it allows us to feel things. And yeah, this biceps anchor and even the biceps is a bit torn. So we're going to clean up things a little bit so we can see a little bit better. But then we're going to be doing what we call a biceps tenodesis. You can see how vascular things are. That's just your shoulder's been trying to heal some of these things for a while now. As we're getting things ready for the biceps tenodesis, we'll look up and we can see this very, very large rotator cuff tear. Okay, so we know we've got our work cut out for us there. As we look down lift straight up on the arm if you can, straight up. As we look down the front of the shoulder, I'm not seeing much in the way of arthritis, a little bit, but not too bad. And then as we work towards the back, we can see, again, just a lot of inflammatory reaction in the joint capsule here. Okay, so now we're ready to go ahead and take a spinal needle and pass it through the biceps tendon. That's a pretty good pass. So that's our first pass. We're going to take hold the camera here, we're going to take a shuttle relay, or what we now call a super shuttle, and pass it through the biceps here, and then we'll take a grasper. We'll show you once we have this secured. Okay, so this is the tear. It's a very, very large tear. That's going down into the joint there. So the anterior part of your shoulder is over here to the right, and it's torn all the way up to where the biceps tendon comes through the rotator interval. We'll show you what that means in a little bit, but basically it's torn all the way up to there. There's your sutures for the biceps, and then it's torn all the way back here, and then in the back it's even a little more complex. It's got this split right here, right where my shaver is right now. Okay, and it's split right here. Okay, so you can get a look at that. So we're going to start with our suturing in the back here to close this split down, and then we're going to see what else we can do. Okay, so there's a pretty good idea, a pretty good look of what's going on. Okay, we'll show you some more in a little bit. Okay, so what we've done so far is we've placed two side-to-side sutures to try and repair this posterior split back here. So there's two sutures lined up back here. A little hard to even see them right now, but they're there. And so now we're going to have a look at the tear. And we can see right here that we're going to place another anchor down way posterior. I'm going to place an anchor way back here and pass most of those sutures posterior, and then we'll place a second anchor, maybe even a third anchor in the front. Pause. Okay, so here's our angle for the first anchor. We can see it's attached. The tendon's attached back there. It's still split. There's not much I can do about that anymore, but we're going to go ahead and place an anchor down right about here. Okay, so here's this first anchor down, and we're just going to look at the sutures and decide which ones we're going to use first. Looks like if we come in front, we can use either the solid blue ones or the blue and white striped ones. We'll get to work and show you some more in a little bit. Okay, so we've got the first anchors, sutures passed and tied. There's three of them. First one's way posterior, and then those two you see there. Tendon's thin. We're going to be adding a Biobrace to it, but we're going to, and before we do that, we've got to add a few more suture anchors, so we'll show you that in a minute. Oh, hit the pause button. Hold it down. Okay, so we've placed 3 suture anchors and used 8 of the 9 sutures. So there's the back. As we rotate, there's the middle, and then if I turn and look to the right, there's the front. And along with that, we've also already tenodesis the biceps down low, and now we're going to place a graft called a Biobrace to cover up kind of the mid portion of this tear. So we're going to go ahead and use a measuring device here in just a second. Can you open up another blue dry dock? Okay, so we're all done here. Let me show you what we've got accomplished. We've got the patch down now, and you can see it's anchored right up against the bone here. And we've also got it tied medially. There you can see the knots there. Okay, and so as I rotate your shoulder, that's moving together as a pretty solid unit now. So I love that. That looks good. We're going to finish up here. We're going to get you back to the recovery room shortly, okay? So good luck to you now. Bye-bye.